Hi everyone, can somebody tell me if I am visible and audible both? Hi, can someone tell me? Yes, thank you so much, Mansi. Yeah, to introduce myself, I am Dr. Resham Vasani. I am a practicing dermatologist at Matunga, Mumbai, and I am also an associate at the BJ Vadia Hospital for Children. I am the educator in the subject of dermatology on Unacademy. And with that, I would like you to get introduced to the iconic subscription. So, the iconic subscription is where you get the best of an academy and the best of prep ladder. So, through Unacademy, you get the live classes and batch courses, and also you get the live tests and the quizzes. While through prep ladder, you get the video lectures, question bank, and the rapid revision courses. So, to opt for the iconic subscription, you need to select the button of iconic. And if you subscribe for 12 months, it would be around 4,125 a month. For 18 months, the subscription would be around 3,300 per month. For 24 months, the subscription is 2,888 a month, while for 36 months, the subscription is 2,300 a month. You can also opt for just the plus subscription of an academy where you have live classes, live tests and quizzes, batch courses, and a structured schedule. For that, the monthly subscription would be around 4,500 for a month. For 3 months, it is 3,750. For 6 months, it is 3,375 a month. For 12 months, it is 2,063 a month. And for 18 months, it will be 1,625 per month. You should also be aware that there is a free live test on Unacademy NEET PG, which happens every day at 9 p.m. as well as 8 p.m. Okay, and it will be a MCQ series of 20 questions, okay, which you can attempt live. For that, what you need to do on your Android or on your iOS platform, you can download the Unacademy Learning App. After you open the app, you can subscribe, and when you do subscribe, you will be asked for a code. If you enter DR Resham 10, you will get an additional 10% off on the Unacademy Plus as well as the iconic subscriptions. Okay, you can either opt for the NEET PG Plus subscription or the iconic subscription as per your choice. There is also a free plan of Unacademy which is available on through the app. To unlock that free plan, you need to use the code DRResham10. Okay, so you please download the Unacademy app, enter the code, and you can access the free content on Unacademy, right? Also, to let you know, there is a batch which is coming up through Unacademy, which is targeted towards NEET PG, NEET as well as INI-CET, okay, which is 2022. Okay, it's a target batch. So there are a lot of educators on this platform, including me, who will be guiding you towards your target of NEET or INI-CET 2022. Okay, so my lectures in the course begin from 22nd of this month and will go on up to 26th of this month, okay, 2020. And the timings are between 7:30 in the morning to 9:30 in the morning. That will be the first session, and the second session will be between 10:30 to 12:30. So I request you to download the Unacademy app. You can subscribe to this course entirely. You can use the code DRHM10 to subscribe to this course. The recommended subscription will be for around 6 months, considering the fact that this entire course will start off from December 2020, that is from 21st December 2020, and it will go on up to May 2021. Okay, so this is all you will need to complete the entire preparation for your INI CET 2022 examination. Okay, so I hope all of you do subscribe to it. So with that, we'll begin our topic for today. I would want everyone to kind of, write what their messages as well as questions as well as the answers on the chat box. Now, so let's begin with this question. All are true about comedones. Okay, all are true about comedones except comedone is a keratin plug of the pilosebaceous unit. When the keratin plug is exposed to environment, it turns black. Comedones are classically seen in acneiform eruption, and giant comedones are seen in hidradenitis suppurativa. So you need to tell me which of these is the incorrect option. Anyone? Definite Singh says it is D. Anyone would like to differ with it? All are true about comedones except. Yes, definite, you are right that hidradenitis suppurativa is inverse acne. Okay, so giant comedones are seen in hidradenitis suppurativa, right? So it is the correct option, but we want to know which of these is incorrect because the question is all are true except. So you have to select the false statement. Anyone would want to answer? The correct answer here is C. Okay, so comedone is a keratin plug of the pilosebaceous unit is correct. When this keratin plug is exposed to the environment, it turns black is also correct. Giant comedones are seen in hidradenitis suppurativa or acne inversa, as Definite Singh has mentioned. Yes, so this statement is also correct. The incorrect statement here is that comedones are classically seen in acneiform eruption. In fact, in cases of acneiform eruption, comedones are not seen. Okay. So, how do you differentiate clinically between an acneiform eruption and acne? Anyone would want to tell me? Now see, if you see acne, it is characterized by the presence of comedones, right? But an acneiform eruption, what is an acneiform eruption? Acneiform eruption is something that will be precipitated by medications. Okay, so an acneiform eruption can be caused because of most common trigger for acneiform eruptions are topical corticosteroids. Okay, topical corticosteroids, if they ask you which is the most common drug to precipitate an acneiform eruption, they are topical corticosteroids. Apart from that, it can be triggered off by systemic corticosteroids, by phenytoin, by lithium, by and those the androgens, the oral contraceptive pills. Okay, these are as well as AKT. AKT, among the AKT, it is INH and PZA, which can cause, that is isoniazide and pyrazinamide, which can trigger off the acneiform eruption, right? So as Aisha Nikhat says correctly, that there has to be a history of some oral or topical medication which can trigger off the acneiform eruption, right? So that is one difference. Second difference is that in acne you are going to see comedones. Okay, while in acneiform eruption usually you don't see comedones, all you see are papules. Okay, and the distribution is also different. In acne, the most common uh, site of acne is the face, right? While in cases of acneiform eruptions, the most common site is the trunk or the back. Okay, so you get a monomorphic eruption. Monomorphic means all are papules, right? So you get a monomorphic eruption of papular lesions on the back. Okay, the second thing is acneiform eruption, it's going to be eruptive. Eruptive means multiple lesions are happening in a short span of time. While acne is not an eruptive condition, correct? So also please understand that sometimes acneiform eruption can be pruritic, while acne is not generally pruritic. So these are the differences between acne and acneiform eruption which you need to be aware of. Okay, so comedones are not classically seen in acneiform eruption. So let's move to the next question. Look at this picture. Okay, you have a 19-year-old female and she presents with several comedones, papules, and pustules on the face and the trunk. The appropriate drug of choice for this patient will it be a topical retinoic acid? Will it be a topical retinoic acid with oral doxycycline, topical clindamycin, or topical azithromycin? Anyone would like to tell me the answer? So Aisha says it's B. Naga Shiromani says it's C. Tejinder Singh says B. And Definite Singh says C. Okay, Aditya is very much pro B, right? So, Aditya and all of you, you are right. It is B, right? So, considering the fact that this patient is having grade 3 acne, where there are several comedones, papules, as well as pustules on the face as well as on the trunk, this female is a candidate for receiving oral medications, right? So, for oral medications, the among the options that are provided to us, the only option which has an oral medication, oral antibiotic, is oral doxycycline, right? So the answer here is B. So when we consider the treatment of acne, if we are dealing with purely comedonal acne, okay, then your treatment of choice would be a topical retinoid. Now topical retinoids, how do they act? What they do is that they will cause the kind of dislodgement of the block. Okay, they are going to act. See, if you see the primary pathogenesis of acne, there is hyperkeratinization, right? That is the first step. uh, Keratinization. Okay, and there is blockage of the duct. There is hyperkeratinization of the sebaceous duct, as a result of which there is microcomedo formation, right? So what tretinoin does is that it's going to inhibit the hyperkeratinization of the duct as well as act as an exfoliant. Okay, as a result of which there is a release of this microcomedo formation, right? So Aisha Nikhat asks me, can be surrounding excoriation? Yeah, Aisha, it is a pruritic condition, but it is not very very pruritic. Okay, excoriations are usually seen when you have an extremely pruritic condition. So excoriations along with acneiform eruption is not something very commonly seen. Okay, Aisha. Now, so let's go to yeah. So I was talking about topical retinoids. So topical retinoids are the drug of choice when you have to deal with primarily comedonal acne. Now, if you have to choose the topical retinoid, you need to know that adapalene is less irritating than tretinoin. Okay, so both are retinoids, but adapalene is less irritating as compared to tretinoin. Okay, so possibly what you can say is, if a patient is having more sensitive skin, then you can start off with adapalene. Okay, if the patient's skin is not very sensitive and has severe comedonal acne, one can also opt for tretinoin. So how do you ask the patient to apply? First, you have to ask the patient to apply, first wash the face, dry the face completely. After the face is completely dry, you take adapalene or tretinoin. Do not take too much, just take a little amount of the size of a peanut. Apply it as dots over the face and then gently spread it so as to form a thin layer over the face. One should not apply it around the eyes, in the crease of the nose, and around the mouth. Okay, now initially maybe you can start off with a short contact. Maybe you leave it on initially only for half an hour and then wash it off. Once you get acclimatized to half an hour, then you increase it to 1 hour, then 2 hours, and then maybe apply overnight. The expected side effects are slight amount of irritation, slight amount of burning sensation, dryness, and exfoliation because of the keratolytic action of the topical retinoids. Okay, so dryness is a side effect of the topical retinoids, and hence, depending upon the skin of the patient as well as of the season, like in this season, if it is winter, you would prefer to apply adapalene if you have to rather than tretinoin. Now if you are dealing with mainly papular acne, okay, so here you have to add on a topical antibiotic in addition to a topical retinoid. Remember, when you are treating acne grade 2 where you have major papules, in such a case do not give only topical antibiotics. Okay, that is not something recommended, because when you isolatedly use topical antibiotics for the treatment of acne, there is a chance that you will promote resistance. Okay, you know that there is this propionibacterium acnes organism, right, against which you are adding the topical antibiotic. So when you just give the topical antibiotic, you have a chance of promoting resistance. So always combine your topical antibiotic with a topical retinoid, or you can add on the benzyl peroxide. Okay, so there are combinations of topical retinoids with topical benzyl peroxide, topical retinoids with topical antibiotics, as well as benzyl peroxide with a topical antibiotic available. Okay, so they have to be combined. The topical antibiotics that are commonly used include clindamycin, clarithromycin, nadifloxacin, and even topical dapsone has been used. Now, the third situation is when you are dealing with mainly pustular acne. Now, pustular acne, the patient we saw in the question had pustular acne, right? So, in such cases, you need to give the patient topical retinoids as well as oral antibiotics. Correct? So, the oral antibiotics that you commonly use in acne include doxycycline, minocycline, azithromycin, and along with that, you can add on topical retinoid with benzyl peroxide, or just the topical retinoid, or just the benzyl peroxide. Okay. Now, among the oral antibiotics that are used for acne, though minocycline is one of the most effective oral antibiotics, it is not very commonly used versus doxycycline, which is more commonly used. The reason being that minocycline has more side effects. So, what are the side effects of minocycline? And these side effects is what you need to remember. Okay, so these side effects are drug induced lupus. It can cause bluish pigmentation of the acne scars. Okay, it can cause bluish pigmentation of the pretibial area, and sometimes this pigmentation can be generalized as well. It is one of the drugs which is associated with a drug hypersensitivity syndrome, and it can also cause hepatitis. Hence, doxycycline is preferred over minocycline because of its safety. Right, now let's go to the next question. You have this 24-year-old male, and he has multiple nodular and cystic lesions with pustular lesions on his face. So what is your drug of choice? Is it acitretin, isotretinoin, doxycycline, or azithromycin? Anyone? Yeah, Aditya Mishra says B. Tajinder Singh says A. Aisha Nikhat says B. Naga is again B, and Manikandan says B. Yes, so majority wins. The correct answer is isotretinoin. Okay, Tejinder, I'll tell you why not acitretin. Okay, oral retinoids include acitretin as well as isotretinoin, but isotretinoin is one oral retinoid which specifically gets concentrated in the sebaceous gland. Right, so that is why isotretinoin naturally becomes the drug of choice for treating acne. Acitretin is also a retinoid, but it does not get concentrated in the sebaceous gland. Acitretin is more useful in disorders of keratinization, like for example in cases of psoriasis, in cases of lichen planus, as well as it is useful in cases of palmoplantar keratodermas. It's useful in cases of there are congenital disorders of keratinization like lamellar ichthyosis, colloidal baby, harlequin fetus. Okay, so these are the situations where you would prefer acitretin. okay, versus isotretinoin. Now, why isotretinoin in this case? Yes, definite seeing. Yes, AML is also one of the indications for acetretin, but here we are dealing with dermatology, so I restricted myself to the indications of acetretin in dermatology. Right. So now let's go on to why do we need to use isotretinoin in such a case. Now, isotretinoin is one of the only drugs. Okay, it is the only drug which is going to concentrate itself in the sebaceous gland. Secondly, it is the only drug which is going to cause the inhibition of cornification of the sebaceous duct, and hence will act at the basic pathology of acne, and hence it will prevent the microcomedo formation. Secondly, it has anti-inflammatory activity. It also decreases the counts of Propionibacterium acnes, which is responsible primarily for the inflammation in acne. Okay, so whenever you have a patient who has acne which is recalcitrant and which is not responding to your conventional treatment with topical retinoids, topical antibiotics, oral antibiotics, or when you have a patient who has been relapsing after antibiotic therapy. For example, if you give a patient doxycycline, till the patient is on doxycycline, the patient is better. Okay, but once you stop the doxycycline, the acne tends to come back. So in such a situation, isotretinoin is one of the drugs which would be preferable. Secondly, if you have severe variants of acne, can anyone tell me which are the severe variants of acne? Severe variants of acne are like acne conglomata. This is nodulocystic acne. See, this is a nodule. Nodule is a primary lesion of the skin where the vertical dimension is greater as compared to the horizontal dimension, right? So, when you have severe nodular acne or nodulocystic acne, when you have acne conglomata, when you have acne fulminans, when you have severe truncal acne, okay, and you have body dysmorphiform disorder, okay, then in such a situation you would prefer to give isotretinoin. Okay, so in severe variants of acne you would prefer to give isotretinoin. Now please remember that isotretinoin, whenever you start it in a lower dose. The reason being that it can cause a transient flare of acne. It can cause a transient flare of acne is because of the release of the microcomedone. There is extrusion of the contents, right? So that is why there is a flare of acne which happens after starting isotretinoin. So sometimes it can also precipitate acne fulminans. So in such a case, in cases of acne conglomata or in cases of acne fulminans, what you need to do is you have to first give the patient oral corticosteroids. Why oral corticosteroids? Because we want to decrease the inflammation, and because when you decrease the inflammation you decrease the chances of scarring. Okay, in such cases the scarring is very very ugly and very very deep, right? So that is why, to minimize the cases of scarring, you need to give initially the patient oral corticosteroids, and then you introduce the isotretinoin in a lower dose. Okay, and then you gradually taper off the steroid and just continue the patient on isotretinoin. Yes, Sajinder Singh, there are side effects of isotretinoin, and hence, what the first side effect and first important fact that one should be aware of before starting isotretinoin therapy is that the patient should not be pregnant, and patient should not be planning pregnancy. Okay, because it is a teratogenic drug. Okay, so first you have to confirm that the patient is not pregnant before starting isotretinoin. Second side effect is it can cause elevation of the transaminases, as well as it can cause alterations of the lipid profile. Okay, so remember that before starting isotretinoin, you should get a baseline SGOT, SGPT, as well as a lipid profile done, and you have to monitor the patient while the patient is on isotretinoin. Maybe not very frequently, but after you start isotretinoin, you do a test after 2 months to look out for the changes in the transaminases as well as in the lipid profile. Also, it can cause dryness of the lips, which is the most common side effect of isotretinoin therapy. So, it can cause chylitis. Okay, chylitis is the inflammation and scaling of the lips. So, that is the most common side effect. Apart from that, it can also cause dryness of the eyes. Okay, especially when you give it in a higher dose, it can cause dryness of the eyes. So this can be very irritating for people who are using lenses. So preferably people who are using lenses, they should be told not to use lenses and wear glasses when they are on isotretinoin. Okay, apart from that, one needs to be aware that it can, if you give isotretinoin for a very long time, especially in the pediatric age group, it can cause something like diffuse interstitial skeletal hyperostosis. Okay, that is called as DISH, DISH. Okay, so I'll just write it down so that it's easier for you to remember. This is a side effect which happens only when you give isotretinoin for a very long time. Okay, so interstitial diffuse interstitial skeletal hyperostosis. This is more prominently seen with acitretin than isotretinoin, but one should be aware of the side effect, especially when you are giving isotretinoin in a younger individual, and that too for a long period of time. Okay, so this manifests as back pain. Okay, and it can cause growth retardation, not growth retardation, but actually it can cause premature fusion of the bones, especially when you give it for a long time in children. Okay, so these are the two side effects which one needs to be aware of when you are giving it in a child. Okay, Swasti says photosensitivity. Now, photosensitivity is something that you see more commonly with topical retinoids, because topical retinoids, you need to topical retinoids, they cause thinning of the skin to some extent, as well as they cause erythema, and the patient may experience burning sensation while going out into the sun. So photosensitivity is more of a side effect of topical retinoids and can be seen with acitretin more than with isotretinoin. Pseudotumor cerebri is a complication which can happen if you co-administer isotretinoin with tetracyclines. So if you're giving the patient doxycycline, minocycline or tetracycline, okay, then it can increase the side effect of a pseudotumor cerebri. So you never, preferably, especially for medico legal aspects, you never co-administer isotretinoin with doxycycline or tetracycline or minocycline. Now, Gokul says increase in the suicidal tendencies. Now, this is not something very common. It is, in fact, you would not prefer isotretinoin if somebody has a very strong history of depressive episodes and suicides in the family. You would not give it to a patient who has already suicidal tendencies and is suffering from depression. Okay, but otherwise, in a normal individual, because isotretinoin gives a very good effect, in fact, depressed people feel much better with the clear skin. Okay, so this is not something very well validated till date. Okay, so I think that yeah, so apart from that, I think these are the major side effects of isotretinoin which you need to be aware of. Tejinder Singh asks me, what do we give in pregnancy for treatment? So if you are contemplating oral medications, okay, for acne in pregnancy, you would prefer to give azithromycin or erythromycin. Okay, because you cannot give doxycycline, you cannot give minocycline, you cannot give isotretinoin, so you can preferably try azithromycin or erythromycin. Among the topical medications that you can give in pregnancy, they include benzyl peroxide, they include azelaic acid. So these are the two medications topically which you can give in pregnancy. Topical retinoids you would not prefer in pregnancy. Okay. Yes, so this is a picture showing acne conglomata, where you can see that there are multiple nodular lesions, and these nodular lesions, they are communicating with each other. Okay, so they are kind of communicating with each other, and they are giving rise to a lot of ugly scarring on the face as well as on the trunk. Okay, so in acne conglomata, there is severe inflammation, there are extensive inflammatory papules, tender nodules and abscesses, and typically there are interconnecting sinuses due to the fusion of these abscesses, leaving behind extensive scarring. Multiple grouped comedones are also typical. So treatment is oral isotretinoin with systemic steroids. Acne fulminans, remember, it is Acne Conglomata along with fever and ulcerative lesions. So it's a rare, severe, fulminant form of acne typically seen on the trunk in males, and it presents as very inflammatory, tender, or ulcerative nodules with crusts. It can be triggered off by oral isotretinoin and anabolic steroid use. It can be thought of as acne conglomata with systemic symptoms like fever and malaise. Treatment is you stop isotretinoin, you give systemic steroids, reintroduce systemic isotretinoin but at a lower dose. Acne excori is where you have compulsive picking of acne, which leads to a lot of pigmentation. And body dysmorphiform disorder is where the patient has acne as the prime symptom. So the perceived acne is out of proportion of the physical signs of acne. Okay, so these are the variants of acne that you should be aware of. I think that's the time that we have today. So I hope this lecture has been informative and useful. So I would request you to join an academy. First, start off with a free plan of an academy and do use the code DRResham10 and to unlock that free plan. And please do subscribe to this upcoming INI-CET 2022 course. And I'm sure it's going to be 20 hours of a lot of information, lot of images, lot of MCQ discussion in the subject of dermatology. Starts off from 22nd of December and goes on up to 26th of December. Right, so see you all tomorrow between 4:30 to 5 for another lecture, and tomorrow I'll be taking up the nose and dermatology. Okay, so see you everyone. Bye. Thank you for listening and for being very interactive. Do give me a feedback of it. Bye.